My first question is, who are they that wrote the bill? You kept referring to them who wrote the bill. So where was this written? Who contrived to write those particular articles as a fifth grader running in?
Well, if you ever watched the Senate in action, you know they have sort of a different way of amending bills. But the truth of the matter is, whoever is governing Congress is ultimately responsible. I can tell you from Ways and Means Committee, we got one 45-minute meeting in a year and a half. Early on, they said, here's what we're going to do. Here's our one-page summary of where we're going. There was no give and take. There was no let's talk lawsuit reform, let's talk how we lower costs, none of that. So I have to say, in this case, the House and Senate leaders and the White House are ultimately responsible.
Okay, thank you.
Yes, sir.
Congressman, I know that one of the mantras, so to speak, in this pre-November election coming up has been, I think, remove and replace, or repeal and replace. But it seemed like that's very, very difficult to do. Matter of fact, practically, you've got a president who would probably, veto anything that would happen like that. How is that politically possible that something like that could be done? Is that the goal that one should take?
I think the goal is improve health care in America, make it affordable, make it more patient-centric, make sure the government isn't interfering between doctor-patient relationship, and find new ways of delivering health care at affordable costs. That's the goal. And part of that, though, is to stop the bad parts of this bill, repeal it or zero fund them if we can, and replace them with something we think that not only does public support, but I think our medical community would support as well. So it is difficult to repeal it in one fell swoop, especially again with the president in the White House. But there are ways. Clearly, if you leave the same people in place, this bill is going forward as is. If you change the players in it and those governing it, then you change the dynamics of the bill, either in its implementation or you raise the issues of here's a better way of getting to the exact same goal. So, yeah. Politics aside, we have to do better in this bill. We have to. So, yes, sir.
Two questions. One, I don't know how many states have already planned lawsuits against this, and so how long do you think that will hold up enforcement? Is the first one. And two, how much did the insurance companies pour into this to keep them from getting reform? Because I don't know if you remember or not, a few years ago, it was on the front page of the Houston Chronicle how much all the CEOs made. And Bill probably remembers this more than I do, but the president of United Healthcare made $15 billion with a B in 1 year. So there's no insurance reform in this bill anywhere, is there?
Not substantial reform, no. They gain.
So how much did they put into it? You know the pharmaceutical networks, not the lobbyists. And
I don't, because they were conflicted. The insurance companies were conflicted. When they saw first they were fighting the public option, the government-run plan for that big first step toward national health care. They were fighting that. When that stopped, then they became conflicted because clearly the government was driving 16 million more customers toward them, and the most of the mandates in there, they don't pay for it. They just pass that on to whoever is paying that insurance premium. So they fought the public option. They backed off on the rest of the bill for the most part. I don't know what the impact on them is going to be. I think they felt like they dodged a bullet on public option, and they have some new taxes and some new restrictions, but they're not major. What was the first one? Lawsuit. I'm not a lawyer of Chamber of Commerce exec, but the constitutionality of the individual mandate is sort of the crux of it. And Attorney General Greg Abbott was on the phone. We did a telephone town hall meeting the other day, asked him about it, and he makes a pretty good case that we've never, as much as the federal government has expanded its powers over the years, and it's hard to get that horse back in the barn, so to speak, never before have we forced an individual to buy a product, to enter a market just to exist. just because they exist in America today, which is what the mandate does. And then what they say is, look, we force people into the insurance market of some type, and then use the Interstate Commerce Clause to regulate them. Now they're in it. They think they have a pretty good case with those 16 or 20 states now joining. I don't know. I don't know the answer. I definitely think it's worth pursuing. I support the lawsuit because I do think that once you do that, there is no stopping expansion government. Period. And he thinks their timetable, because there's no real discovery in this bill or in this lawsuit. People know the Constitution, they know the bill, so there's not a whole lot of legal wrangling for years and years to find out what's behind the scenes. That he thinks they can get a court ruling by the end of this year. Whoever loses appeals, whoever loses that appeals, but he thinks they can get it through to the Supreme Court within 2 years. Under time, I don't know the outcome. What's that?
Stand still until that happens, or?
No, it goes forward. They have an injunction in the lawsuit to stop this till that case is resolved, but I don't know what the court does with that. I think it's worth pursuing. I don't know the outcome. Yes, sir.
What's going to happen with the Medicare reduction in costs, and all the other insurance companies are going to follow suit?
Yeah.
Already we've got a notice from Blue Cross that they intend to reduce payments by about 15 to 20% starting in July.
Yeah.
And so, if Medicare does this 20% reduction, or if they delay it, or the other insurance companies, it sounds like they will follow suit and just step in line.
They've been doing that for years.
One, you're not going to see a reduction, period. But two, I don't think you're going to see a resolution either. The best opportunity to fix the SGR once and for all was in the overall health care reform. There's no question about it, because it's so big, just because it's so big. And now, speakers in a bind. They pulled you aside, said we'll figure that out later. They've been kicking the can down the road. When Republicans were in charge, and you had to come up every year or 2 years, it was embarrassing. It was embarrassing to me as a Republican that physicians had to come spend time away from their practice and all they do to come up and tell us something obvious, which is, we can't afford to cut, in cost of living. Nothing in our office has gone down. What are you doing? The best hope was to fix it in here. It isn't. Now they've extended it through May, but they don't know where to go from there. They don't know where to go. What we offered as Republicans a month or two ago was a 4-year fixed 2% increase, and it was fully paid for, so it didn't add the deficit. Our point was, let's at least give some certainty for 4 years to physicians in this, while we work, and while you work, whoever's in charge, on a final solution. So I honestly don't know where they're going to go. They're in a pickle right now. So you need to keep that pressure on in a major way for as full a solution as you can possibly get. There's political support for it. There's no question about it. But also, now Democrats are they have a problem because they've said, we will fix that. Then they, for political purposes, pulled you out to make it look balanced. Now, and they've said, we're going to pay for all new spending. Well, now they got to figure out how to pay for $248 billion, and they don't have it. So, and frankly, we're not going to help them pay for something they said they would. So,
I'm not sure, besides the point, what's the purpose of all this? Why would some organization get into such a self-destructive process? Or is there beyond this scope?
There is, I think the answer is there are a couple just dramatically different ways, philosophies in how you deliver health care in America. And there's a belief by one that the profit motive needs to come out of health care, that we would be better in a single-payer system, or at least more of a government-run system, and this is designed to move us that direction. So, and they see it as very hugely popular, despite what the polls say and what people say in Washington right now. They are really doing a celebration dance on healthcare. They believe if they'll just keep explaining to the public more and more, that they'll come around and see what a great solution this is. But I'll tell you, in our district, we've been doing healthcare issues a long time, from 50 Ideas to Improve Healthcare to the original CHIP program to all of that. I've never seen a more informed electorate on healthcare than we have right now. Not everybody. I'll tell you, people can come up to you on the street and talk to you about community rating, cost shifting, Medicare reimbursement. I mean, average people can tell you about insurance markets, lawsuit reform. I mean, it really is amazing. And the more they learn about the bill, the less they support it. But in Washington, there's a disconnect. They really think this is the next best thing to sliced bread. And if they'll just keep talking, people will go pissed off.
Congressman, do you have an alternate plan you think would be more appealing and more acceptable to
Yeah,
Americans?
and what we did wasn't necessarily our idea. We listened to, for example, the Texas Medical Center leaders, which involves so many different organizations who said, look, keep the best part of healthcare, but work step by step to improve them, what needs to be improved. They said, don't do it all in one fell swoop. It's too complicated. So that's what we did. The bill we offered, 4807, 4837, said basically let's focus, that first step ought to be price. So lawsuit reform in a major way, letting businesses join together, small businesses to get discount rates like the big guys, allowing buying across state lines, so we introduce some competition. Right now, insurance companies have each state market to themselves. That's why 2/3 of the state, there's one insurer that dominates everybody, because they work at the state level and they limit that competition that way. So you open it up, which we thought would also help drive down costs. And we did some other things like allowing people to keep their kids on until 26, and we use the state high-risk pools to do pre-existing illnesses, because the problem you have now is what happened in Massachusetts. Everyone's going to have government-approved health care. The worry is people will wait till they're sick, then they buy it, they keep it till they're healthy, and they get out. That's what's happening in Massachusetts. About half of all the new plans, the length of stay in that plan is 5 months. So you're in when you're sick, you drive up the price, and then you get out and you're not part of it. So we just thought, look, you already have a flawed model in front of you, pay attention to it. And the fees, the taxes for not having insurance, they start at 1% and $95 a year. Okay, that isn't going to scare many people. It maxes out at $695 a year, or 2.5% of your income. So someone over 27 years old, not on their parents' plan anymore, is going to have to figure out what's cheaper for me. Pay $60 a month and not have health care and wait till I'm sick. Okay, that didn't take a whole lot of math to figure that one out. So that's the concern on that. Yes, sir.
Morning. Thank you for your summary on the reform. One of the provisions off the 2010 that was missing is physician restriction on joint venturing and ownership, which will end the 31st of December this year, as I know it. How do you reform that, repeal it, and will you personally introduce legislation to do that on our behalf?
Yeah, well, I will, but here's why. I think there's a better way to tackle physician-owned hospitals than just setting a firm date for. No, Steve, and I've had a lot of discussions about this, but one, the original bill was retroactive to January 1st, which had a huge impact on our region in Texas. I think we would have 40 hospitals representing about 15,000 jobs that would be stopped under that plan. They moved to December later on in the year, which covers some of them, but still creates problems for those under construction. And then finally, you have the problem of growth, which is this is what I've learned about healthcare. You guys are much more knowledgeable than I am. But picking one model that's supposed to work across the country It never works. Each region has sometimes academic models, not-for-profit models that work perfectly, some for-profit, others doctor-owned hospitals. Some are a blend of them, but they're designed for their region. I was just down in McAllen here looking at their physician-owned hospital down there to try to understand who they were seeing and what kind of care they were providing, and because of that provision. And I'm convinced that rather than the government pick the model that should be the winner, that we ought to be fostering all those models depending on what the region needs. And the growth in some areas that are met by physician-owned acute care general hospitals is real. So yeah, I think that restriction both on time and on growth are bad for our healthcare system. So yeah, we are going to move to repeal.
Thank you.
I do think there are ways to address some of the specialty hospitals that we've had problems with. The concern, I'm not equivocating, concern is I want more choice, I want better quality health care. I also don't want to get to the day where a general safety net hospital is only seeing the poorest and the sickest patients in this country and are being reimbursed at 60 cents on the dollar. That model doesn't sustain itself either. So we got to fix a couple things on that issue. What's your thought?
Pretty much along the same line. You open it up to competition. If your reimbursement's going to be fixed, or you think it'll be fixed, or if it's based on quality, just business is competition.
Somehow, though, I do wish we could figure out. Right now, we've put so many conflict of interest rules in place, sort of pitted doctors against hospitals and created a tension there. I keep thinking there's got to be a way we can have all be working the same direction. You know what I mean?
Mm-hmm.
Toward patients, on quality care, on equipment, on imaging, on all those things. And I still think at the end of the day, if the government would reimburse you fairly for the services you provide, there probably wouldn't be as great a need for revenue from other sources, bottom line. As one doctor told me during our 50 Ideas to Improve Healthcare, if you can't make just a decent living seeing patients in your practice and following them, then we're all doomed. That was his quote. But his point was, that's what we went to med school to do. You know what I mean? Not to have to juggle 60 or 70 patients, just to try to, get the numbers up to meet the monthly nut that you have to do, and never imagine all the people you have to hire just to keep up the paperwork from us and the insurers. There's got to be a better way than that. You tell me. Yes, Tom.
What is the true incentive to fix, at least permanently fix the SGR when by 2014 we're going to have this committee that will end up deciding what reimbursement is anyway?
The real incentive is that if Congress doesn't fix the SGR now in some meaningful way, there is a real concern. Seniors are going to have to hunt to find a doctor to see them. And I know...
I'd be curious just how many of us take Medicare right now, and if the 21% cut goes through, will you still be taking Medicare? I mean, how many take Medicare right now? And 21% cut goes through, how many will be taking it? So, but, I mean, I realize the immediate, so that to me that's more of a political game, saying, okay, for the next couple of years, we're going to stop this mess. Then in 2014, Congress loses a lot of the authority to be able to even decide what is going to be there, because this committee of who knows who's going to be on it. We probably won't even learn who's going to be on it. We probably won't even know at the time who's going to be on it. We'll actually decide reimbursement. So to me, it almost seems like we feel like, I feel like we've been thrown under the bus now. But really, it's almost a game that we've been thrown under the bus for good, because now yes, we'll fix it now, maybe, but by 2014 it's not going to matter anyway, because all our reimbursement will be determined by this committee. And we all know that our private pay insurance is based on Medicare anyway. So just give that 2 more years, and all your contracts will be based on the new Medicare anyway. So, what is the true incentive for fixing it?
I don't think we have a choice. And I still think, you tell me, but, for the first couple times this came up, physicians said, okay, I understand, you didn't get it done in time, and we'll work with you and all that, but that's happened so many times. My sense is physicians are just sick of it. You know what I mean? Are tired of having to, again, to just, beg to not be cut. It's ridiculous. And I think most lawmakers understand that without physicians to see our seniors, we got a far more serious political problem and healthcare problem than just fixing the problem. So,
I agree it has to be fixed, but I guess
the worry about that commission is, if you ever dealt with MedPAC, and everyone has, you think Congress doesn't listen? Listen, wait till you deal with MedPAC, because we deal on a variety of issues, not just physician reimbursements or other issues, but specific illnesses and cuts that they've made that actually drive patient groups. For example, those with immune deficiencies, the way they've structured the reimbursement, they drive them into a hospital, in effect, for their care, when probably the safest or the least safest place to have someone with immune deficiency is in a hospital. Probably smarter to have them in doctors, or if they can do their home, get their home care there, makes more sense. They're just deaf ears, all that. The solution is such a small adjustment, has such a small financial change in it, impact in it, and they just won't do it. So the worry is they're going to be those guys on steroids. Yes, sir.
Well, one argument for trying to fix the SGRs, when this board comes about, they'll start at that as their starting point. But if you're a member of that committee, or whatever you're on the board, it'll be like being a member in the grand jury or the draft board. Those of us who were involved in the draft back in the 60s, you never knew who was on the draft board. That was a secret. You couldn't know. Nobody knew. I happen to know the guy across the street was on there, but that was just by accident. I didn't know any other 10 or 12 people that were on there.
Finish this, give the state of this bill. We're going to be able to attract the best. We have a shortage of 40,000 doctors for sure. We're going to be able to attract the best and brightest to medicine in the future. Looking at this. I'm not trying to plan. This is what you've been telling me. I'd like to hear from you. Good doctor.
Let me just see my vision what's going to happen for the next 10 years. You're going to have more universal or government-based health care. You're going to have minorities who makes good money. They're going to do touristic medicine. They're going to go to Mexico and get treated. All these professionals that you're going to have better quality and whatever they want to do, for themselves and maintenance. And we're going to be stuck with these patients and the government-based patient in the emergency room and the urgent care, treating them for free, because this is the law. This is the law. What's the solution? We're going to treat them for free because he has no insurance, or because he has private insurance that never got fly to Mexico or McAllen next door and get treated with a 5-star and the best option and the best doctor available to see you the next day. Board certified, American. This is received.
Yes, sir.
Kevin, I have a 17-year-old daughter, senior in high school, who just got accepted to Rice, has been a top student, basically has wanted to go into medicine. One of my only kids was my 10 that wanted to go into medicine, but nonetheless, she did until this bill passed, and then she's expressed serious doubts lately. That's without my prompting. I've left her alone. My comment to her was, if it's your passion, you should do it. But if it isn't, look at it carefully. Well, she's looked at it, and she thinks maybe she may want to go into a different field now for that. That almost saddens me. What does?
This is more of a philosophical question, because I want to know what the proponents of the bill position on this, because it's been tried
government-run healthcare several places. It doesn't work. Even the combo thing in Ireland, they had something on Good Morning America, the combination plan, where they have a mix of government-run and private. Doesn't work. Doesn't work in Massachusetts. So I want to understand from their viewpoint, their arrogance, why they think they can make it work when nobody else can.
Well, there's an arrogance. And I can't
So that's
answer.
the biggest problem, I think. I think somebody wants to have their name on healthcare reform, whether it works or not.
Yeah, and they're, yeah. And I'll tell you again, that disconnect, honestly, the president is, right now in Washington, is almost exhausted. And they're talking about Speaker Pelosi is the greatest speaker, in American history. But in the real world, it's so different than, it is so dramatically different than that. It's like there's two different planets that you fly to every Monday morning. You know what I mean? Up there. I'm not being critical, I'm telling you, what I see up there and what I see at home is just night and day difference. And I'm convinced they believe that the public will forget by November about this bill, you know what I mean, and the whole process. And I just don't think that's going to happen. And I think that arrogance is going to come back.
Well, why do they think it's going to work? How do they support when it hasn't worked in, however many years? What is their response to that?
This will work. It's going to work, and you're going to love it. I mean, that's the response, and it's just us naysayers, again, I know the AMA was in, talking to these guys. I know, American Hospital Association was in visiting with them. I still don't know. One, the two highest priorities for our physicians were fix the STR and medical liability reform nationwide. Did you see any of that in there? For hospitals, I think they ended up deciding 40 cents on the dollar for Medicaid is better than 0 on the dollar for uncompensated, uninsured walking through the door. But, they got some small updates and all that, but I don't see what the hospitals...
The truth of the matter is, because of inside information that I received, frankly, through Dan Wolterman, our president, who knew people that were in that meeting, said that Obama's thugs, literally, came to meet with AHA, and they said they've never been in such a brutal, threatening meeting in their entire careers. They just basically said, if you don't support this bill and go along with what we want, we will do horrible things to you afterwards. I mean, I've never heard anything like that in my entire life. In my entire career, never heard anything like it. They said they just came in like, they're getting accused of being a Chicago thugs that they are. And they said that's the way they treat them. They just went in and just threatened the leadership of the American Hospital Association into submission that if they didn't do this, much worse things were going to be done to them. That's what happened.
I know this. In our region, the private numbers the hospitals give us are scared as a result of this bill. We're not talking about that. It's the numbers are really bad.
Well, Moody's just came out with their outlook for not-for-profit hospitals especially, and it's very, very poor. The outlook is very dim for hospitals as a result of this bill.
Yes, ma'am.
I can help to feel like this health reform bill is structured like those subprime mortgages, where there's a lot of sleight of hand, a lot of stuff are taken out of the equation when they really should be in it, and we know what happened, bankruptcy. So what's going to happen?
Designed. That's the perfect analogy. That's exactly how it's designed. It is low rates at the beginning. In fact, only taxes at the beginning. Spending ramps up. We put all the budget, the timing gimmicks in the first 10 years to make it look like an adjustable rate mortgage. The question is never, what are my payments at the beginning? It's always, can I afford my payments once it gets ramped up? And as a society, we can't afford that. And again, rather than trim it down, which was what we said, sit down with us, let's go back to basics of what we really ought to be doing. It's a much smaller bill. It is a much different cost factor that without all the programs, without so many to mandate, but that was just not an option for it. But that's the perfect analogy on it. It is adjustable rate loan, it's a balloon payment, it's those zero interest credit card, offers. So yes, sir. Oh, I'm Dr. Reed, and then we'll go back. Yes, sir.
I just, we've had this discussion before, but Medicare and Medicaid are both government-run healthcare entities. I can understand our reimbursements coming down more in those systems where there is a lack of money. I don't understand the commercial insurance companies dropping our reimbursements every time Medicare does when they are having these huge profits and huge CEO bonuses. And I don't understand why everybody just lets that happen.
Next question. I don't have a good answer for it. I really don't.
They're not lacking in money to reimburse physicians.
I do know, I don't think the answer is to put another national insurance control over the state ones. I think that creates more problems along the way, but I don't know the real answer. I do think part of it, though, because I really do believe in the free market, if you've got state-by-state markets that protect you the way it is, why would you want it to change? You know what I mean? Why would you want to reduce any barriers that might create competition where people have the opportunity to shop for different plans, where you have to pull that pricing curtain back so people could actually have some choices. And then one thing, we've talked about this before, you tell me this all the time, and I'm now a believer, you can't control healthcare costs from above. If we get the patients actually at stake in the cost of healthcare, you can control costs from the patient up. As long as they have skin in the game and they know good behavior has good impact, ignoring your orders in between visits has bad impact, and they'll pay for it. Until we drive quality and affordability, make choices from below, we're never going to have real reform. You've told me that over and over again, and I believe I'm a believer in all that. Yes, sir.
It looks like somewhere down the road that there's going to be a need for substantial new tax revenues. Where do you think structurally those things are going to show up?
Yeah, well, you guys are the first line. Because this bill, by taking the $200,000 and $250,000, the two top tax brackets, and driving a surcharge for Medicare and new investment income, and no one's much hollering about it, that's really emboldened them for the next, which is later this year. They're going to continue the Bush tax cuts, but for professionals and small businesses in those two upper tax brackets are going to see increase in about 35 to 39% for the top bracket, for example. Plus, and you think that's a lot of money, but an equal amount of revenue comes from limiting your mortgage deductions, your charitable giving deductions, and a number of things. That generates just as much as the income tax increase, plus the cap gains and dividends, again, from investment incomes, all of them go up. So for starters, you're the first source of revenue from individuals. But I can tell you, not just this healthcare bill, but our debt, $1.2 trillion a year, and that's going to go for a decade, every year for another decade. We could double everyone's taxes in America, and we'd still be running a deficit. I mean, literally. So they're going to have to look at that, and they've got a lot of tax increases on energy companies, the real estate companies. They've got a lot of business income they're going after that they banks, and they can demagogue some and they can tax you, and you're now the wealthy. So they are looking at a VAT tax. I mean, they are looking. The reason they're floating it today is to see what kind of pushback they get for a value-added tax, which, again, on top of what we have, the VAT tax is the politician's dream tax. It's hidden, it sounds small, and taxpayers never know they pay, because it ends up at each step in production getting added on. So it sounds like it's 2% tax. That's not much. By the time it is added to each step, the final price is 20% higher. But it's not broken out. Consumers don't know it. So I think they're going to go for something like that in the future. But initially, it's going to be the two top tax brackets that bear. And by the way, in case you don't think you pay your fair share, top 5% of all wage earners pay shoulder almost 2/3 of the whole federal government. It's the top 5% shoulder that today already.
Just a comment. Victoria King just came back from England and talked with a physician over in England and said this is not including the value-added tax, which is pretty significant over there as well. 63% of his income is taken out in taxes. Think about that in your income, 63%, right off the top, if you ever get your paycheck.
Well, between the Medicare surcharge, the investment income, that's 3.8%, plus taking you up to 39.40, plus the deduction. If they extend the Bush cuts, increase the top bracket to 39.6, take away the deductions, limit the deductions, which really take you up to about 43%, and then the Medicare surcharge on that, you're at 40.
3.8.
No, that's before the Medicare surcharge. So you're at 45% before. We don't live in the state with income tax, but you're at 45%. Growing by the end of this year. Yes, sir.
I just want to change the thought a little bit. But, I guess I've become more politically active this year, obviously. But I want to get to the midterm elections. In being inside the Beltway, what is the pulse of seeing some dramatic changes in the shift of, I'm going to say, political power in the midterm elections? I mean, do we feel like we're going to see a dramatic shift, or?
If I may add a part B to his question, and what would the impact be if there is a change on this?
And also, too, I mean, obviously, you're on our side, you're my congressional district, but what can we do for like other congressional districts to, try to see and help some of these other individuals that are challenging seated, congressmen or senators, to help them as well, too?
Yeah. Well, this is a nonpartisan gathering, so I'll just make it sort of in general terms. If you want to change the bill, you have to change the players, who are writing and implementing this bill. So, and the best chance of that is in the House. There's no question Republicans will gain a lot of seats. Whether they can gain the 40 to become, to take the Speaker's gavel and make these changes, that's a huge hill to climb. It's only happened twice before in history. But I think, I was in a meeting with in leadership here last Thursday, and I think it's possible. I think it's possible. The second, to answer your question, is that with the change of government in that governance in the House alone, while it makes it difficult to repeal major sections of this bill, the House itself can zero fund those and refuse to implement the bad portions of that bill. It sets up a showdown with the president and probably with the Senate, but it changes the dynamics dramatically on this bill. And then finally, the thing you can do is there are, of those 40 seats, I've met almost 100 candidates in 100 seats that are first-class people. I mean, are active in the community, or, the type you would say that person's going to make some good decisions. And there are a lot of those candidates that could use help. And if you'd ever like a list of those that you might want to look at to help, I'd be glad to share it with you. And I do hope associations are paying attention to those candidates too, because some of them are, rock solid people. I think could make a big difference. So, that was as vague an answer as I could give while still delivering the message. So,
I think we need to wrap it up.
What can I be doing? What can I be doing both from a physician standpoint, the healthcare providers, from the hospital standpoint? What do we need to